Coming out of my training, I had a number of attending faculty. Very common in medicine. Different clinicians have different views, so I could see the spectrum. Those who are really old-fashioned, those who are more like technology geeks, and people in the middle. My decision was I wanted to know all my options. I wanted my toolbox to be as big as possible. So whatever's out there, I want to investigate, try it myself, and see how it works. So that was how I decided that I want to join LANAP. As a procedure, I like it. It's very different to what the majority of dentists will go through training in dental school for. It's really working with energy, which to a dental student or to a dentist, I think that's a relatively new concept. But I will say that I remember during one of my CE courses, I met a dentist older than me who said when he graduated in 1981, high-speed handpieces were new at the time, and a lot of people were saying, oh, this is very dangerous, we're going to harm patients. And I do not think that there's a dentist on the planet today that could work without it. So the idea of a new technology can be fearful for some, but I do think that it should be explored first and tried out. Being a periodontist and dealing with gums, the way I saw how I handled the gums of my first LANAP patient, I liked it. And I think this is something that I will explore more. And if the results are good, I'm going to continue using it. The training was very thorough. It was good to actually hear it from a clinician perspective, a scientist perspective. I think it's very good that there's a focus in this program to know the basics behind LANAP, even though it's a little bit of raw science, but it makes the understanding of the concept way better, and I'm sure that will make the application way better. And to be honest, that's the kind of training that I was looking for. I didn't want just someone to show me how to use in the patient mouth and that's it, because I don't think that would help me to give the best care to my patient. It would be a good idea if such technology, with the behind-the-scenes science, can be studied at the level of residency and not to be primarily for those who are already established periodontists. I think it makes a big difference when someone like me, just fresh out of school with all the data in his mind, studies this versus someone who's been out of school for 10 plus years. And that would be definitely good for patients when periodontists at the beginning of their career, they can provide that.